Dear friends, good evening, good morning, good afternoon, wherever you may be. I welcome you to this session. The topic I'm giving to speak to, challenges of infertility, the way forward. Like you have heard, I am not a medical doctor. I am a marriage consultant, and even though I'm a midwife, I'm not practicing midwife. So I am talking to this subject from the point of view of Catholic marriage. I'm a Catholic marriage consultant. And so I gave it subtitle of, can you see the video?
Yes.
Can you hear me?
Yes, we can hear you.
Thank you. All right. So I gave it the subtitle of
Yes, we can hear you.
Okay, thank you. Managing infertility within the Catholic marriage. And friends, I'm aware of the fact that some people may be listening to me and they are not Catholics. But I can assure you that what is good for Catholic couple is good for you, it's good for everybody. Our services are not just for Catholics, they are for everybody who is created in the image of God, and I think everybody is. So, just to give a little context or background, we know childlessness continues to be a challenge for Catholic couples who struggle to remain faithful, fulfilled, and happy in their marriage. And that's God's design. That's how marriage is meant to be. But because of the concept that procreation is a gift, a blessing from God, childlessness remains the scourge of a devastating sense of failure for many couples, sometimes perceived as a curse, especially on the woman. Indeed, it is a major threat to faithful monogamous marriage. We as church need to help engaged spouses to understand the implications of children as gifts. We say it, and we will name our children gift, but do we really understand it? That children are not right to marriage. The fact that you're married doesn't mean I have a right to have children. No, they are gifts, and God is the one that gives the gifts. Also, we need to help them understand the many ways that sacramental marriage can be fruitful, even if it is childless. As Christians, we can also help enlighten the wider community through our own attitude to childlessness in marriage. The church authentically teaches, in the words of the Council Fathers, that marriage, to be sure, is not instituted solely for procreation. Rather, its very nature as an unbreakable covenant between a man and a woman and the welfare of the children both demand that the mutual love of the spouses be embodied in a rightly ordered manner, that it grows and ripens well into old age. Therefore, marriage persists as a whole, 100% manner and communion of life, and maintains its value 100% and indissolubility, even when, despite the often intense desire of the couple, offspring are lacking. This is from Guardian Space number 50. John Paul II in 1982 repeated it, Familiaris Consortio number 14. So we know marriage is, children are part of the reasons why people marry, but it does not invalidate marriage if children are not there. This is my presentation outline. We look at what is infertility. There's also subfertility. Infertility, there's primary and there's secondary. What are the possible causes of infertility? There are male factors, female factors, combined factors. But also it's important for us to understand that there are also unexplained factors in infertility. As at now, anyway, science doesn't give answer to everything. Then we will look at management of infertility, which are divided into prevention, medical and surgical approach, morally acceptable assisted reproductive therapy via technology, spiritual, emotional support for couples struggling with infertility, adoption of children, not surrogacy. Also, we are going to look at integrating infertility within the Paschal mystery of Jesus Christ. Who said, if you want to be a follower of mine, take up your cross and follow me. So couples are disciples, and this discipleship of suffering and infertility can be part of that. So, simple definition of infertility is the inability of the couple to become pregnant or to conceive following regular sexual intercourse for a year or more. Primary infertility refers to a woman not conceiving at all, no conception. A woman can conceive and have abortion, there is conception. She can conceive and have miscarriage, there's no child, but there's no live child, there's conception. So primary infertility is where there has been no conception at all. Then secondary infertility means the inability to conceive a second or more times. Subfertility, different from infertility, means that conceiving without medical intervention is possible, but will likely take a longer time, longer than a year anyway. In summary, infertility means no conception in 12 to 18 months with frequent intercourse. And you can see the couple there, you can see their posture. That alone shows the impact of infertility: sorrow, deep emotional, psychological, physical, spiritual, and even social pain. How often does it happen? Globally, up to 1 in 6 couples are infertile. So it's quite common. Globally, up to 1 in 6 couples. Causes, like I mentioned before, can be male factor, female factor, combined factor, and unexplained. So management, the way forward is we seek help as early as possible, but at the same time, we trust in God. Is really what conception is for those of you who may not know. Conception simply happens inside the woman when these 3 things, I don't know if you can see my cursor, these 3 things, this is the sperm from the man, the egg from the woman, and this is cervical mucus from the woman. These 3 things must be inside the woman at the same time within 24 hours, within 24-hour period. They must be in the woman at the same time. If not, if one of them is missing, there'll be no conception. And so, if there is any problem with any of these things, problem with sperm, problem with egg, problem with cervical mucus, there will be no conception. Or if there's any reason why the 3 of them cannot meet at the same time in the woman's body, that would cause infertility. Statistically, worldwide, I've already mentioned that approximately 1 in 6 adults globally are infertile, and this is World Health Organization. This equates to roughly 17.5% of the adult population. However, in sub-Saharan countries like Nigeria, Community studies show localized infertility rates spiking between 20% and 30%. And sadly, most times the overall burden is on the woman. She bears the brunt of infertility. 20% and 30% is a little, but I mean, it's not too much. 17.5 is global. So 20%, 30%. Let's look at the possible causes of infertility. Age is a major cause, especially in the Western world and among our educated elites here now. Many couples are surprised to learn that fertility naturally declines with age. Natural family planning education encourages couples to understand that female fertility begins to decline in the early 30s. In fact, by the time a woman reaches 35, she's already in her pre-menopause. And then menopause can happen any time from then. Male fertility also gradually declines with advancing age, even though it's not at the same pace as that of the woman. This knowledge helps couples make informed decisions about family life. Now, a little word about the female decline. You know, a girl child is born, or a baby girl is born with all her eggs in her, but it begins to mature and be released from puberty. She begins to see her menses. A boy child is not born with any sperm at all. He begins to develop sperms, to produce sperms from puberty. And he produces sperms in millions. Whereas a girl child, the eggs that she was born with, they are in thousands. So you can see the difference there. Why a girl must not compare herself to a boy. Biologically, we are different. So this knowledge should help any couple make informed decisions about family life, when to start and how to start. Other factors include, for the men, low sperm count, poor quality sperm, inability to ejaculate, low production of testosterone. Testosterone is a hormone that is a male sexual hormone, actually, for male fertility hormone. And there are others. For the woman, that's what's called polycystic ovarian syndrome, PCOS, which may lead to problems of ovulation, that is release of egg, maturing of egg, release of egg, and sometimes no egg. There is also what we call exploitation. Exploitation will lead to scarcity of eggs or no eggs also. There is blocked fallopian tubes, which are caused by so many things, including infections. Endometriosis, which is infection of the inner lining of the womb of the woman, which will make, even if fertilization takes place, which happens in the fallopian tube of the woman, the womb cannot hold the child. The child cannot grow in the womb, which is also an effect of some hormonal contraceptions. Sometimes fibroids may be the problem, not always, but sometimes. Then contraception, hormonal contraception and implants. There are various ways of affecting either the ovulation, the eggs, or the inner lining of the uterus. Then there's hormonal imbalance, which can be as a result of so many things for the woman. Then there's combined factors. Any 2 or 3 of the above coming from both husband and wife can cause infertility. But one of the ones that I found quite surprising in the beginning was wrong timing of sexual intercourse. And this is why we feel that every man or woman should learn natural family planning. If they are not married, they should learn fertility awareness. I have had couples where they have gone through medical tests, everything was right, but yet they couldn't conceive. And it was just simply because they were timing intercourse at the wrong time. But knowledge of NFP would help them know when the woman can become pregnant and when she cannot. For a man, well, the sperm is there always. But for the woman, the egg is not always there. So the cervical mucus is not always there. Also, worry and anxiety for both of them or even for one can delay conception. So the management, I'm talking about approaches. Like, you know, this is a big topic. If you give me how many days, if I can work on it, but, you know, I'm just giving you tips. You can discuss and ask questions later. So I'm using approaches for the management. There's preventive approach, which is very vital. There's counseling and education approach. There's medical approach. There's pastoral and spiritual approach. There's also social approach. Let's briefly look at these approaches. Now, like I said, I'm talking from Catholic point of view. Implications for Catholic fertility ministry and healthcare. And I am encouraging societies like yours and, you know, dioceses and parishes even to start fertility ministry. That's one way, and healthcare. That's one way to, you know, tackle this whole thing of infertility, which is becoming a kind of epidemic. So in our care, we must begin with the couple. We must recognize them, that they are human beings. And care should focus on both spouses, not just on the woman or just on the man, both of them together. They should be listened to and assessed together. Fertility care should resist cultural patterns that automatically accuse or blame the woman. We must resist that and try to educate our people. We must protect the dignity of the spouses as human beings created in the image of God, even if they are childless, as well as respect the sacredness of their marriage, which is a sacrament. And I am very sure you know what I mean by marriage being a sacrament. Sacrament in the Catholic Church, we say, is the outward sign of an inward grace. Inward grace, the grace that God gives us to live our lives the way we should live in order to enjoy heaven at the end of life. We are not really created just to be in this world, finished. We have a better end, utmost end to heaven, to go to heaven. So we must recognize their marriage as being a sacrament, whether there is a child or no child. Understand that infertility is a complex problem that causes personal suffering to the couple. Infertility is not an evidence that God has rejected the couple, or that the woman is cursed, or that the husband is insufficiently masculine, or that the marriage lacks value or fruitfulness, or that another partner, whether man or woman, or that the couple has failed. No, it's none of this. In our care, we must be empathetic and we must show compassion, but we must avoid promising pregnancy. Rather, we emphasize on the importance of trusting in God. We must explain that some causes of infertility can be corrected or treated. Some can be improved, but others cannot be overcome with available or ethically acceptable treatments right now. Note that compassionate care offers truthful hope without guaranteeing a child, because if you guarantee and it doesn't happen, that has its own effect again. We must integrate pastoral and medical support. Couples who are going through infertility, suffering the impact of infertility, would need careful fertility evaluation, marriage counseling, and other support. They would need spiritual accompaniment. They will need mental health support. They need protection from family or community cohesion. Education and support in discerning morally acceptable treatment. There's a lot of treatment, but they are not morally acceptable and not approved by the church. Assistance in recognizing the fruitfulness and dignity of their marriage, even when conception does not occur. This is very, very necessary for couples to realize that their marriage is still fruitful in other ways. And there are so many ways marriages can be fruitful, even if a child is not there. We must prioritize prevention in our management system. It is a major aspect of infertility ministry, prevention. And this is, I'm speaking now on a broader basis. Now, those responsible include within the family, parents as enshrined in their role of responsible parenthood, guardians and all responsible adults in the family, the church, schools, organizations such as youth, family organizations like your own, CMO, CWO, and the young person himself or herself should take responsibility for his or her fertility health, fertility well-being. Catholic healthcare institutions, Catholic medical doctors and midwives should play their role. The society in general, including and especially the media, should be a little more responsible in responding to infertility couples. Indeed, all of us should be involved, but we must know what to do and how to do. So the preventive approach, and this is the one for everybody, the preventive approach aims at helping young person to develop habits to live chastity and value-based characters for healthy living. So the aim is to help young people to stay away from sex and to be faithful to their spouses when they marry. Chastity goes across, even for married people. That's the exclusive free self-giving to one another by husband and wife. And also, children must be helped to develop value-based characters for healthy living. Within the Catholic Church, in the family and human life units, we have a lot of these programs that can help parents. Okay, let me see. This should involve proper teaching on human love and sexuality, beginning in early life. And it is the duty of the parents to actually do this. Proper teaching on human love and sexuality, beginning in early life. That's what we call age and language appropriate methodology. This is what parents should learn, because if a child is helped to develop such habits and grow into strong character, they respect their bodies, they respect other people's bodies, and a lot of infertility would be prevented, I can tell you. I'm using the structure of preparation for marriage within the Catholic Church. We have remote preparation, which is, like I said, is done within the family by parents for children. Then we have proximate stage of marriage preparation, which is when children actually start going to school, to church, to society. And again, responsibility, parents are still there, but the church and society takes responsibility to instill good character in these children. And again, we have programs for young people to help them learn fertility awareness, or to become very aware and befriend their sexuality in a healthy way. Then the final stage for preparation is a proper and intentional third stage of marriage. The church takes responsibility while the parents are still supporting. The young couple themselves should learn, and if they really want to live responsible parenthood, they must learn natural family planning, because that is the key to living responsible parenthood to the full. Catholic health facilities can prevent some infertility through prevention and treatment of sexually transmitted infections, higher quality obstetric care, prevention of postpartum and postoperative infections. And this is where it's good to go to hospitals for these things, proper hospitals, see real doctors. Responsible use of antibiotics, adequate and proper treatment of mumps in the boy child. Boy child has mumps, people will go and buy medicine, do this, and no, take them to hospital, please, because it can have unpleasant lifelong impact, and infertility is one of them. Early treatment of pelvic infections, metabolic screening, healthy nutrition and physical activity, diabetes prevention and treatment. Education concerning fertility health, reproductive aging, and exploitation. I hope you understand what that word means, exploitation. If you don't, bring it up during the question time, please. Catholic vision of fertility care. I hope also you know what I mean by fertility care, taking care of our reproductive system. Catholic vision of fertility care is based on accurate knowledge and practice of natural family planning. Natural family planning teaches that fertility is not simply the ability to conceive a child, but it is a gift entrusted to husband and wife by God. And if it is entrusted to husband and wife by God, they need to learn and understand the body, respect its natural rhythms, protect reproductive health, and seek treatments that restore normal function. And that's an expression of good stewardship. A gift given to us or entrusted to us, we need to account for it in the end. Fertility care, therefore, becomes more than a method of family planning. It becomes the ministry of health promotion, disease prevention, early diagnosis, restorative medicine, and accompaniment of couples as they seek to live their vocation to marriage with generosity, responsibility, faith, hope, and love. So let's quickly say, what is natural family planning? There are many definitions, but this is the one I use. Natural family planning is a way of life for husband and wife. So it's for married people only. Natural family planning is for married people only. Young people can be taught fertility awareness. And it's a way of life. Like, we are Christians. Christianity is a way of life, but we still practice Christianity. So that is how it is for NFP here. It comprises of methods by which a properly instructed couple plan to achieve or postpone. Note the word I've used, postpone, not avoid, because pregnancy is not a disease to avoid, but you can postpone pregnancy by applying appropriate sexual behavior during the fertile and infertile phases of the menstrual cycle of the wife without recourse to non-natural means. And I say it is grace. As you know, grace comes from God. We already know that fertility is a gift from God. And to live it and live it responsibly, we need the grace of God. And this grace is plentiful within the sacrament of matrimony. It is science because it's based on biological science, facts you can see and verify. It is art. Art means that, like driving, like music, playing a musical instrument, painting. Somebody has to teach you, and you have to learn, practice, and then you become proficient and live it happily. In Nigeria, there are 4 methods that are available. Love and life ovulation method, which stems from Billings method. Symptothermal method, There's couple bead method, which is the one that I actually teach. There's Crichton method, which is an NFP aspect of NAPRO technology. Some of you might have heard of NAPRO technology. We'll come across it again. I will explain further. There are other methods outside Nigeria. However, all of them, all these methods, they are based on the menstrual cycle of the woman. The basic fertility literacy just takes care of this. This is representing the menstrual cycle. It's a cycle. And you can see there are 3 main phases in this cycle. You can see the red representing menstruation. You can see the blue indicating when the woman is dry, that fertility is not possible, conception is not possible. And you can see ovulation, the yellow part. That is the only time this woman can conceive. And this is about 5 to 6 days. 3 to 4 days before ovulation and the day of ovulation itself. Beyond that, this woman, the woman cannot conceive. So learning NFP means, studying these things, understanding how they work, and being able to chart them on a daily basis, being able to interpret your charting, and then live it by applying, depending on your intention, to have children or not to have children yet. Apply your sexual life around there. We continue to explore the connection between natural family planning and fertility care. In fact, knowing and respecting the body. And one of the greatest contributions of natural family planning is that it teaches couples to understand and appreciate the remarkable gift of human fertility. Rather than viewing fertility as a problem to be suppressed or ignored, NFP views it as a sign of health to be understood, respected, cherished, and cared for. This knowledge helps prevent some causes of infertility, facilitates earlier diagnosis of fertility problems, and guides couples towards treatments that seek to restore normal reproductive function whenever possible. And here, I recommend natural procreative technology, which is in short, NAPROTEC. We have the experts all over the world. Here in Nigeria, I'm almost sure there's one in every state, but even in dioceses, they are there. Just find out from your family and human life units. Or you can also reach me if you need some of their addresses, contacts. So let us now focus on managing infertility on a broader basis again. Excuse me, on a more specific basis. Sorry, we have done broader aspects now with anything. Natural family planning promotes, preventing infertility. Natural family planning promotes habits and knowledge that help preserve fertility throughout life. Understanding the normal menstrual cycle, women learn that a healthy menstrual cycle, what a healthy menstrual cycle looks like, and recognize when something is abnormal, including irregular or absent ovulation, unusually painful periods, abnormal bleeding, unusually short or long cycles, abnormal cervical mucus patterns, because if any of these is present, conception cannot happen. But through NFP, you can learn and protect or prevent or heal. Protecting fertility through chastity. You said it, that chastity is a way of life that helps prevent a lot of infertility in later life. Natural family planning education naturally includes an understanding of God's plan for human sexuality. Therefore, faithful monogamous marriage and chastity before marriage, enhanced through fertility literacy or natural family planning, strengthens loving relationship in the home and greatly reduce the risk of sexually transmitted infections. If you're chaste, you will be getting sexually transmitted infections. Pelvic inflammatory diseases will be very much almost eliminated. Tuber scarring due to infection, chronic pelvic pain, male genital infections. Most of it come from sexually transmitted disease. Studies have shown that in many parts of Africa, preventing sexually transmitted infections is one of the most effective ways to prevent infertility. NFP, caring for the body. Fertility reflects overall health. Couples learn that caring for their bodies also means caring for their fertility. That's as simple as that. This includes maintaining a healthy body weight, regular physical exercise, good nutrition, adequate sleep, managing chronic diseases such as diabetes, reducing stress where possible. Harmful substances can affect our fertility. Men and women learn that fertility can be damaged by tobacco, excessive alcohol, recreational drugs, anabolic steroids, environmental toxins. Healthy living protects reproductive health as well as general health. Environmental toxins, that involves a lot. Now, how NFP helps in diagnosing infertility. Natural family planning provides valuable information that can assist health personnel rather than simply asking whether pregnancy has occurred. Fertility awareness helps answer why pregnancy has not occurred. So, charting may reveal absent ovulation, that's release of an egg, or irregular ovulation. Short luteal phases, prolonged cycles, abnormal cervical mucus, possible hormonal disorders, PCOS, possible thyroid disease, possible endometriosis. And instead of waiting for years before seeking help, couples often recognize problems much earlier if they are living NFP. For physicians and midwives, a fertility chart becomes another important clinical tool, much like blood pressure record or glucose log. So if even we have a unit of fertility care, this fertility charting should be part of what to be used. Number 3, helping couples achieve pregnancy. One of the original purposes of natural family planning was to help couples conceive. By recognizing the fertile window, couples can time intercourse when conception is most likely to happen. Like I said, I know many couples who became pregnant after they have known the right time for them to have sex. Many couples previously thought to be infertile simply had intercourse at the wrong time in their menstrual cycle. Correct timing alone may significantly improve the chance of conception. Guiding restorative treatment. And what we mean here by restorative treatment simply means help couples or guide them to heal whatever is causing the infertility, and then they will conceive naturally. Fertility awareness does not stop with diagnosis. It helps physicians identify underlying conditions that can often be treated. And there are some examples here: thyroid disease, elevated prolactin, PCOS, nutritional deficiencies, obesity, insulin resistance, diabetes, luteal phase deficiency, chronic infection. The goal is not merely to make the couple become pregnant, but to restore healthy reproductive function as a whole. And that's a huge difference. Medical approach and assisted reproductive technology by specialized medical experts. Generally, this is the area of obstetricians and gynecologists who normally conduct series of examinations and tests on the couple. Making an accurate diagnosis is vital and should be followed by appropriate treatment that restores the normal function of the body. A couple must be patient and follow through the long and unpleasant journey while all the time trusting in God. Again, I recommend obstetricians and gynecologists that are also NaProtec experts. The common thing that people do, the IVF, is not, and I repeat, is not recommended. The church does not approve it, not only because of its ethical issues and negative impacts on health, but also for its costs and failure rate, which in turn poses mental challenges on the couple. I have had to deal with couples who have had this IVF with all the money, not the cost. It failed, and they were devastated. So, but in any case, ethically is wrong. IVF is wrong. There's gamete intrafallopian transfer. I'm not sure this is available in Nigeria, but wherever it's available, it's approved by the church. Indeed, natural, ethical, procreative technology is the way to go after prevention. Now, major differences between NaProtec and the IVF. NaProtec, as I said, means natural procreative technology. It follows the natural rhythm of the body. It makes diagnosis and treats the body and lets the couple conceive normally, naturally. But IVF goes against the natural rhythm of the body and grows a baby in a test tube. Indeed, a baby should be the result of intimate relationship of father and mother, not the result of masturbation and a test tube. There is no exploitation in NaProtec, whereas IVF is one of the major causes of exploitation and all its associated complications, and there are many. NaProtec respects human life at its earliest stage, the embryos. When fertilization has taken place, we call them embryo. That's the stage of human life. IVF disrespects and even, in fact, abuses and kills human life at its earliest stages. They send embryos, they throw them away sometimes. There's no fear of any short or long-term negative impact on the child. With that's with NaProtec. With IVF, a lot of reservations. There are a lot of reservations over the negative short and long-term impact on the child. You can even Google it yourselves. How fertility is a sign of health. Natural family planning teaches this. Perhaps the greatest lesson of NFP is that fertility is not a disease. I keep repeating that. Normal fertility often reflects healthy hormones, healthy nutrition, healthy relationships, healthy lifestyles. Changes in fertility may be an early sign that something else in the body requires attention. Learning to observe fertility, therefore, becomes another way of caring for one's overall health. So there's a lot of advantage in natural family planning. The couple's responsibility. The couple themselves now. We have talked about the responsibility of the society, the medical professionals. Now, the couple themselves. Natural family planning teaches that fertility belongs to both husband and wife. Women observe and understand the signs of fertility. Men should also understand, because they normally would discuss with their wives. It helps the men to protect and support fertility by maintaining their own health and loving relationship, avoiding tobacco, excessive alcohol, drugs, heat or radiation around the external parts of the reproductive system, the penis and the scrotum. They do this by wearing very tight pants, carrying phone in pockets all the time, regular, very long bicycle rides in hot weather. It may interest you to know that, God in his providence and his wisdom puts the men's scrotum and the penis outside of the body, because the sperm cannot resist heat. The sperm cannot resist heat. It dies within minutes. For example, if there's no cervical mucus in the vagina of the woman and they have sex, No matter how many millions of sperms deposited in her vagina, they will all die within minutes if there's no cervical mucus there to nurture and nourish them, keep them cool. So men must avoid certain things that might affect their scrotum, heat around their scrotum. Maintaining a healthy weight, exercising regularly, these are also always coming up with emphasis. Plenty of fruits and vegetables. Seeking evaluation along with the wife when pregnancy is delayed. That's the husband seeking evaluation along with the wife when pregnancy is delayed. Infertility should never be viewed as a woman's problem. Both husband and wife share responsibility for preserving, understanding, and evaluating their fertility. The pastoral or spiritual approach. Again, children are gifts from God. They're not a right because you're married. The Bible and the Catholic tradition give us a lot of insight and examples of couples who face the challenge of infertility and how God intervened in their cases according to his will. To just name a few, Abraham and Sarah, they were past childbearing when Isaac came. Hannah, Samuel. Now, Joachim and Anne, our two ancestors that we celebrate today. Today is their feast day, 26th of July. It's their feast day. And they are the parents of our Blessed Virgin Mary. They had infertility problem. They had issue with their fertility. God intervened. Zachary and Elizabeth, as John the Baptist, and many others. They all prayed and trusted in God, and he answered them. But also, we must be aware, we must remember that God's answer may take different form also. It's not just that there must be a child. God has a way, different ways of blessing people, as long as the fault is not from them, humanly speaking. Then the social approach, Catholic marriage is complete even if it is childless. That must be, everybody must know that. Husband and wife need to be kind to one another. Ensure a loving environment in the family. Remain best friends to each other. Society must destigmatize infertility. Stop all forms of discrimination against childless couples. Families of origin should offer support and encouragement, not suppression and castigation, mostly of the woman. Proper and approved child adoption is a very good option. Sometimes people hesitate child adoption. It's a very good option. In fact, it's doing charity, especially in our country where you have so many abandoned children, so many abortions because young girls feel they cannot keep a child. Adoption can be total or it can be partial. Adoption is the way, not surrogacy. The church does not approve surrogacy. Hopefully you understand what that surrogacy means. Remember, all of us are Christians are baptized. All of us that are baptized Christians, we are all adopted children of God. So there shouldn't be any hesitation about adopting children, please. It could be partial, it could be total. Now, finally, infertility and the mystery of the cross. When all human efforts appear to have failed, we should be able to say, may God's will be done. Childlessness in marriage can rightly be incorporated into Christ's paschal mystery of suffering, death, and resurrection. Pastoral care of such spouses in the light of their faith can help them live a vibrant, full, and fruitful married life. And I've seen it happen. Their cheerful generosity towards others, especially children in need of affectionate love, food, clothing, shelter, education, and brighter future, and others, inspired by their faith, hope, and charity, can in itself be exemplary witnessing to other couples and families within their community, their help, their approach. And that's when I said, adoption can be partial, it can be total. Their approach to children who have parents, yes, biological parents, but parents are poor, they can't do much. So this is mission, and it's bearing fruits that will last, according to John 15, verse 16. But childlessness also, like I said, all of us, married people, and even those of us who are celibate, we are all disciples. We are all called to discipleship. And our discipleship bears fruit, whether we have children or we don't have children. It has fruit. And Christ is the one that told us, if you want to be a follower of mine, my disciple, you must, he said you must. He didn't say you may. So you must carry your cross, take up your cross and follow me. The Bible verses are where they are coming from, they are there. So childlessness can be a way of discipleship, of a way of couple carrying their cross and following Jesus, as long as bring us to heaven. That's our utmost goal, our final goal. So couples must, and we must encourage them to trust him who came that we may have life and have it to the full. He knows us and he knows what's good for us. And so when we have done our best, healthcare, people have done their own, everybody has done their own, and it's not happening, we must trust that he knows what is good for us and he will do it. So I say, may our Mother Mary intercede for us all, especially for couples who are going through difficulties at this time due to childlessness. May she intercede for them. Thank you, and may God bless you.